you're ready to go. Today, we are going to be talking about reaching your physical utopia. I will be introducing our lovely speakers today. Dr. Brandon Grubbs received his PhD in exercise physiology from Florida State University in 2017. Dr. Grubbs' training at FSU has allowed for mastery of measuring muscular and functional performance in older adults with intensive experience in exercise therapies that combat aging and disease. Dr. Grubbs has been an assistant professor of exercise science at Middle Tennessee State University since August 2017. His current research explores the influence of frailty syndrome on lower limb muscle power during a functional sit-to-stand movement in older adults across care continuum. He is the co-founder and co-leader of the Positive Aging Consortium. Next, we have Dr. Vaughn Berry. He is a teacher and researcher here at Middle Tennessee State University since 2011. Prior to his employment at MTSU, he trained at the University of South Carolina, Ball State University, and Brigham Young University. His research and career goals focus on measuring physical activity levels, connecting activity levels to health outcomes, and helping others improve and maintain healthy levels of activity. He enjoys being active with his beautiful wife and 3 children. Co-presenting alongside Dr. Grubbs and Dr. Berry is Dr. Linda Bloodworth. Linda graduated in 1982 from Samford University and went on to obtain an MS in physical therapy from the University of Alabama at Birmingham in 1985, and a PhD in health and human performance from Middle Tennessee State University in 2016. Since joining the NHC in 1991, Linda has held several managerial positions: Director of Physical Therapy at the NHC Murfreesboro, Regional Physical Therapy Manager and Regional Outpatient Contract Manager. She is currently the Regional Rehab Consultant for the Metro Nashville, Tennessee region. In 2009, under Linda's direction, the NHC received accreditation from the APTA for Geriatric Clinical Residency Program. She developed the program in its curriculum and continues today as the program director. Please welcome Dr. Grubbs, Dr. Berry, and Dr. Bloodworth.
Well, we are happy to be here today. I'm going to start us out. I'm Dr. Berry, just to kind of put the names in the places: Dr. Berry, Dr. Grubbs, and Dr. Bloodworth. And today we're going to be talking to you about reaching your physical utopia. And I'm excited to do that. Let me get our clicker here. So we want to talk a little bit about what is utopia. First, utopia was coined in a book in 1516 by St. Thomas More. And he put this, as he described this utopian concept, it was this far-fetched, imaginary, amazing place. Okay? And as I thought about that, I Googled utopia, obviously, as everyone does when they're thinking about stuff. And these are the questions, these are the pictures of a utopian society that I found. Often futuristic. It joins with nature. It's imaginative and it kind of blows your mind a little bit. And it's far-fetched. Well, when we talk about physical utopia, we want to bring that down a little bit to something that is manageable, something that we can attain, and we can attain that today or in the near future. So I'd like to define what physical utopia is for our presentation. It is achieving and maintaining a physical fitness level that allows for 2 things. Allows for you to maintain your health and allows you to do what you love to do. And if you are doing those 2 things, I feel you are maintaining a physical utopia. So, how do you determine what is your physical utopia is where we want to start. First off, I would like for you to think about the future. In the future, what are your goals and aspirations? What do you want your life to be like physically? And only you can decide what your physical utopia is. I can't decide that for you. Only you can do that. Okay? So where do you want to be in the future? As you do that, and you're kind of defining your physical utopia, we also need to take into account your past, your physical activity levels, your physical experiences in the past. We also need to take into account your current medical status and your current physical activity level. But combining those together, we can then define where can I be in the future, and what do I want to work for? So on the next slide, I'd like to introduce you to someone that I feel has done a great job of that. And he's been able to find his physical utopia and maintain that over time. And I've seen this personally because this person is my dad. Okay? And my dad is great. Here he is with my two brothers. He's a retired dentist, and in fact, my brothers are dentists and took over his practice. He's been retired now for 7 years. And I'd like you to zero in on the middle picture here. This is my father a week before his 69th birthday, and he just won a triathlon, biking, swimming, and running a week before his 69th birthday. Now, I think with me saying that, let me just say he's had his fair share of physical trials, and he hasn't always been at this physical utopian place. But with each trial, he's able to get back up, dust himself off, figure out what to do, and get back there. And I think that's where all of us can do. And that's why I felt like he was a great example of someone that can do this for us. So as you see this, I want you, now that you've kind of semi-imagined your physical utopia, I'd like you to imagine this is you standing on this podium. You have managed to get to your physical utopia. You did it. I want you to imagine that you've been able to do that. Dr. Grubbs here is going to talk with us and share with us ways that you can get to that point. Dr. Grubbs.
Great. All right, thank you. So I'm going to talk about developing your activity cocktail. All right, your activity cocktail here. I'm going to answer some questions here and give you some scientific-driven recommendations that will help guide you in your decision making as far as selecting activities that you enjoy, working at an intensity and spending time in those activities that will ensure that you are meeting the recommendations of physical activity to improving your health and your function and helping you reach your physical utopia. All right, so I want you to take a look here at this cocktail glass here, and you're going to see some ingredients. All right, these are called, the acronym is FIT, F-I-T-T, and it stands for frequency of activity or exercise, I for intensity or how hard you're working, time, the time spent engaged in that activity, and T stands down here for type, which is the type of exercise you're doing. Okay, so I'll address these common questions about exercise and activity with respect to improving fitness for the rest of the presentation. Okay, so we're fortunate right now to have activity guidelines, right? And these were first developed in 2008 and have recently been revised in 2018. And they are just what the title says. These are our physical activity guidelines. These are parameters developed through data from science that demonstrated how long and how hard we have to work to improve our fitness. Because the more active you are and the more fit you are, the reduced risk for the development of disease. And disease slows us down. Okay, so I want you to notice some things here about these guidelines. Okay, you're going to see some numbers with respect to time spent exercising. You're going to see some directions here on intensity type, moderate and vigorous. And then you're going to see some instructions here about type of exercise. You'll notice aerobic, and you'll notice muscle strengthening activities. Okay, so I'm going to go through how the direct application of following these guidelines to your daily lives so that you are on your path to reaching your physical utopia. Okay, now, the acronym is FIT. I'm not going in that order because I've decided to go things in order of importance, from my opinion here. The first thing is T for type. This is the first ingredient we're going to cover, okay? This is choosing the exercise activity of choice, all right? That matters most to you, what you enjoy most. So you'll see two tables here. One is aerobic activities and one is muscle strengthening activities, okay? So aerobic activities, I want you to think of endurance-like movements. Okay, these are aerobic activities are exercises or movement that is repetitive. Okay, it utilizes the major muscle groups of our body. Think endurance activities. So you see things like walking or hiking, water aerobics, swimming, yard work such as raking or pushing a lawnmower, recreational activities like tennis and basketball. All right, these are things that are sustained, okay? Now, muscle strengthening activities are a little different. They're usually in shorter duration, and they require you to develop force and strength to do that activity. Typically, you're lifting, pushing, or pulling, moving something, okay? And you're having to use more strength than perhaps what you would do performing daily activities of living, okay? The most important thing I want you guys to get from this slide is that you're choosing to find and do things that you love. If you choose and you can explore and find things that you love that require you to exert yourselves, whether that be aerobically or through muscle strengthening activities, you're more likely to do it. And the theme here in reaching your physical utopia is consistency. This isn't a fad diet. This is about behavior change. This is about becoming active more throughout your week in such a way that perhaps you're active every day of the week. All right? And so we're more happy doing the things we enjoy doing rather than the things that we dislike, right? So let's go to our other ingredient, I for intensity. So intensity is how hard you're working, how much effort you're putting forth in that activity, okay? Now, the intensity, how hard people have to work is different for each person. And the reason that is because our perceived effort that we give into an activity is often determined by our current level of fitness. People who are more fit have to work harder to reach the same intensity in comparison to someone who's deconditioned or less fit. And you might notice this at some point in your life when perhaps you began to exercise and things were challenging. But you continue to do that activity over time, and it might have felt easier to do the same thing, okay? But that's because your fitness improved, all right? And so how do you know if you're working at moderate or vigorous intensity? Those are the intensity levels that are in the guidelines, okay? I'm gonna give you a couple ways so that when you're doing something that you love, you're being active, you will know if you're working at a moderate or vigorous intensity, okay? The first one is a 1 to 10 scale, all right? And you can see this scale over here on the right, okay? The lower numbers down here that start are 1 or 2. This is very light intensity, very minimal effort required to do that activity. And of course, as we go up the scale here, you'll see that the intensity level increases, and so does the change in the face of this individual as he's working at maximal intensity. But luckily, we don't have to work at maximal intensity in order to receive health benefit from activity, okay? So if we're exercising or being active, a moderate intensity should feel around like a 5 or 6 out of 10, all right? While a vigorous intensity should feel beginning around 7 or 8, all right? Some other things that you can notice while you're exercising or being active are changes in the speed of the heart rate, okay? At moderate intensity exercise, you'll note there's a noticeable increase in heart rate. And that happens. The more effort, the more strenuous an activity, our heart rate will go up, okay? Changes in breathing will parallel that change in heart rate, okay? So you'll experience a noticeable increase in breathing, all right? Vigorous intensity, both these changes are magnified. Heart rate is going to be a larger increase. Respiration, a larger increase. Okay, and you're going to feel like you're working harder. All right? There are other ways to monitoring intensity so that you know what you're doing is helping you meet the guidelines to improve fitness, and that's heart rate monitors. Okay, you can find these just about everywhere now. I'm wearing one now. This is an Apple Watch. Garmin and Polar are other brands. Fitbit also, some versions of the Fitbit will monitor heart rate. So you can determine the intensity at which you're working at in real time. It also, many of these devices will store that information. So you can keep track of your activity history. This is great in the bigger scheme of things here as far as developing your activity program as it changes over time as your fitness improves. So let's go to another ingredient, frequency, okay? So frequency and time are two different ingredients in this activity cocktail. Time, in my opinion, is much more important, time spent in activity across the week. However, this ingredient F for frequency, this allows us to break up our activity and structure our activity across the work week and across each day so that you are planning your activity around your day. All of our lives are a little different. What matters to us is different, but we're all up in the morning and we're all going to bed at night. Okay? But what's important is that we all find a way to plug in activity, okay, so that it's consistent, so that we're reaching our physical utopia. Okay, so I have some goals and some structure I can give you here. The ultimate goal is to exercise most days of the week. Most days is 5 to 7. All right? This is optimal. This isn't necessarily feasible for most people. We all have to have a starting point, right? So it's actually recommended by the American College of Sports Medicine, an organization that looks at all this science and takes professional opinions on different populations and illnesses, and they look at the data and they develop recommendations for people for each of those things, all right, using science. ACSM for most conditions and populations, healthy or unhealthy, recommends a minimum of 2 days a week of aerobic activity, a minimum of 2 days a week of muscle strengthening activity. 2 out of 7. Okay, you can even do both on the same day. You can break it up across the day, across the week. All right, that's the beauty of frequency here. Okay, now if you start with this alternative goal, you should consider, it would be my recommendation, that over time you're trying to add more days of activity. Okay, I'll explain why that's important shortly. Okay, so 2 to 3 times a week minimum, that's a great way to start. You want to build to 5 to 7. Okay, time. Time spent being active. This is dependent on intensity, all right? This is another ingredient of our activity cocktail. So time spent in activity is really dependent on how hard you're working. The more effort you're giving, the more intense you're working, the more difficult it is to sustain that activity, all right? Think about times where you ran, okay? To run as fast as you can, the time spent trying to do that is much short-lived than it was to, say, jogging to a destination, all right, at a slower pace, all right? Lower intensity activities can be sustained longer than higher intensity activities, which require more energy and effort, okay? That's a relationship that exists between time and intensity, okay? So some goals, all right? The recommendation is that in a week, you do at least 150 minutes of moderate intensity activity. So if we look at that concept across a week or even a day, all right, 30 minutes, just 5 days out of the week, will get you to accumulating enough time and activity to meeting the minimum recommendation, all right? Now, if you're working harder, you can do less. It really is, within a week, a 2-to-1 ratio, all right? If you work at moderate intensity, you have to work twice as long to achieve the same benefits than if you were working at higher intensities. But higher intensities are uncomfortable. Maximal physical effort can be an uncomfortable feeling, okay? But luckily, we can work at lower intensities and still get benefit. So I've provided some examples here on the right side on how you can break up this accumulation of activity across a day, okay? And then that'll add up across a week. And just the 3 days I have here, on the first day, a brisk walk. So this is presumably at moderate intensity. 10 minutes before breakfast, 10 minutes before lunch, 10 minutes before dinner. It doesn't matter how long you're exercising in that bout, okay? According to these recommendations, it's about the total amount of time accumulated. So when you think, oh, I don't have time to do this or I don't have time to do that, you really do, because of the concept of accumulating activity across a day. It doesn't have to be a single setting. You don't need 30 minutes to be active. You need just a few. But just consider where you can plug that in. Okay, so an example, day 2, 45 minutes of yard work. Let's say if you have some big oak trees, right? We're proceeding from fall into winter. Those things come down. That's some sustained aerobic activity, right? Something you have to do but counts towards the minutes accumulated to meet the minimum recommendations. And many of you are members of St. Clair Senior Fitness Center. If you attend one of their 1-hour classes, you're only 15 minutes short. It's Monday, Tuesday, Wednesday of meeting the recommendations of 150 minutes of moderate intensity. It's only Wednesday. Okay, that's how quickly you can accumulate that time, okay? So look at frequency as a strategy of breaking up time, all right? And then think of time as a concept of adding or accumulating minutes across a week that we can add up, broken up across a day and across a week. So besides your physical utopia, being active, if you follow these recommendations for activity and you use the ingredients here in your activity cocktail, there's so much more benefit than just reaching your utopia. Okay, besides enhancing our physical function and our ability to live independently, okay, we can reduce risk of falls and injuries of falls. Exercising also alleviates fear of falling, which is a common barrier for activity for people who were previous fallers. Not to mention it can slow down the development of functional limitations that over time lead to disability and loss of independence. It's also exercise and activity. Man, the evidence is so strong about the almost pharmacological-like effect that exercise has on disease. It's considered therapy and treatment. It can also reduce feelings of anxiety and depression. So, physical utopia, be active, make my cocktail, I follow it, I'm on that journey, but I also get so much more, okay, just from being more active and more fit. So this isn't a research presentation, but a lot of the evidence and guidance I'm giving you is driven by science. And so I couldn't help myself but to include one very important slide that I think says a lot by itself. When we are more active and more fit, generally, the speed at which we walk, normal walking speed, is faster. And the speed at which you walk has been shown to be so highly predictive of what your health can be in the near future. All right, so what I'm showing you here, this is a figure from a scientific publication by Fritz and colleagues, a great mixture of PhDs and physical therapists that gathered a bunch of evidence from large-scale studies that looked at outcomes like functionality, independence, hospital admissions, discharge to home versus skilled nursing, just based on how fast someone walked. And the evidence is so strong and predictive. They've given this test, walking speed, the name the sixth vital sign. That's how strong it is. And we pay attention to it in research in exercise science. So what I want to just quickly show you here, you see speed across the top here. All right, so as we go to the right, we are walking faster. All right, and that's similar information that you see down here. So let's just look at 0.8 meters per second and faster. You'll notice the color green, okay, on that right side. All right, and that green is indicative of people who are walking in those speed ranges are more independent in activities of daily living. All right, they are less likely to be hospitalized because of an adverse event. They are more likely to be discharged home as opposed to a skilled nursing facility from the hospital, right? And skilled nursing is a place you go when you require a lot of medical care and attention after hospital discharge. You'll also notice on the bottom here, people with faster walking speeds are capable of crossing streets, ambulating within the community. But as we go left, you start to see things turn yellow and red. Okay, so how do I use this information as a researcher and as a practitioner? As I tell people who have slower walking speeds, we've got to increase your activity so we can improve your future health outcomes. And we can do that with interventions that increase your walking speed. So being active and being fit in the journey to your physical utopia can do a lot more for you than just what matters to you at the end of the tunnel here, okay? The idea is to maintain independence and quality of life. So some of you might be thinking, wow, this is great information. However, my life and my health is just flat out complicated. It's not black and white for me. I have ups, I have downs, I've got a history. So is it safe to exercise if my health is complicated? The answer is it depends, and I put depends in gray because it's very variable. All right, but I can give you a couple of key parameters to keep in mind when you're making decisions about designing your physical activity cocktail. All right, the first thing I want you to keep in mind are signs and symptoms suggestive of cardiovascular, metabolic, or renal disease. And so cardiovascular disease could be congestive heart failure. This can be stroke, okay? This can be a heart arrhythmia. All right, metabolic disease could be type 2 diabetes, okay, problems regulating blood sugar. And renal disease is just kidney disease. And of course, that can impact your ability to regulate blood pressure, all right? So here are some major signs and symptoms of those three categories of disease, all right? It's a lot of words up there, okay? And you don't need to memorize them, okay? Thank goodness, because we are in such a push to driving people to being more active, we've simplified things. And so there's actually a questionnaire. It's called the PAR-Q. It stands for Physical Activity Readiness Questionnaire. And this is a yes or no questionnaire. And you go down the line and you answer a couple questions. And based on your responses, it's covering this information in the presence of disease. And it will guide you. It'll say, nope, sounds like you are cleared to get started based on how you answered, or it's recommended that you follow up with your GP before you get started, okay? So that's just signs and symptoms of these diseases. If you've been diagnosed with cardiovascular, metabolic, or renal disease, and you're inactive, as defined as not exercising 3 days a week for the past 3 months, at least 30 minutes of moderate intensity exercise, you need to consult your physician before you get started. You have to think of exercise as a stressor, okay? Your body will respond to it. And your physical activity cocktail is like a prescription drug. You can, by modifying the ingredients of that cocktail, you can modify the strength of the cocktail. You can modify the strength of the drug that your doctor may prescribe you. Okay, think about that. The dosage, the frequency of consumption. Okay, so if your body is not functioning optimally, exercise can cause some trouble, and it may exacerbate a pre-existing health condition. So if you're experiencing any symptomology, talk to your doctor, stop exercising. If you have known disease, cardiovascular, metabolic, or renal, and you're not active, just consult your doctor, okay? If you're in recovery from a recent injury or from illness, I would consult your physician. It depends on the seriousness of the condition and how far you are in recovery. But if you're just flat out uncertain, reach out, okay? The nurse or the doctor will review your case, and they'll either give you a thumbs up, a thumbs down, or one in the middle, and they'll say, here are some parameters to follow. It's safe to exercise, except just stay within this window, okay? So don't let your health be the deciding factor on whether or not you can pursue the journey to reaching your physical utopia. As I've mentioned, there are recommendations for the use of exercise as treatment or therapy for a number of chronic conditions. And I can tell you, having read and utilized a lot of these recommendations, not once does it say, because you have this condition, you should absolutely not exercise. You should be as inactive as possible, and you should lay in your bed and rest. Not a single one provides any sort of description that would lead you to being less active. There are recommendations for cardiovascular disease, heart transplant, valve replacement, inpatient, outpatient. There are recommendations to use exercise as treatment and therapy for pulmonary disease, vascular disease, obesity, metabolic or diabetes, osteoporosis, cancer survivorship, brain health, and for arthritis. Exercise is recommended to treat these things. Fun fact, something that lights my fire in this field, many pharmacological drugs, the drugs you would take prescribed by your doctor, and the treatment in a number of these diseases activates the same cellular pathways as exercise. Where do you think some of these drug treatments start? Right? So consider this, not as a barrier, but an opportunity to do more. Well, okay, all right, Dr. Grubbs, you're reeling me in a little bit, but, I don't know. Is it worth doing anything at all? I just don't know if I can even meet the recommendations. Yes, absolutely. Any activity or exercise is beneficial. The difference between meeting the recommendations and being active and not meeting the recommendations is just the improvement and the level of the improvement of fitness or health, okay? So how can I incorporate bits and pieces of activity if maybe I'm really deconditioned, really inactive, and I'm struggling to comprehend and apply this concept of being more active most days of the week. So the strategy I would provide would be consider breaking up periods of inactivity with any type of activity. All right, so let me provide you a scenario. Okay, you're watching your favorite 30-minute show, or perhaps you're reading a book from your favorite author, doing arts and crafts, whatever. You're seated, okay? Consider when there's a commercial that you get up and just go walk around the house, okay? Go throw the ball a couple times with the dog, all right? Even just stand up and sit down in your chair 10 or 15 times, right? Trying to use those muscles, okay? That's going to be beneficial in comparison to just staying seated. So activity, technically, physical activity is anything that requires an energy expenditure or effort above rest. So this is activity, sitting and standing and walking. All right, now the recommendations, that's the gold mine. That's where you want to be, though, to optimally improve health. So try to incorporate this type of strategy and then rinse and repeat. Just get into a habit, okay? Just get into a habit of breaking up inactivity. So there's a few things to consider, okay, when developing your physical activity cocktail, all right? Your cocktail should change, just like your taste changes over time, all right? And this is important because there is a law called the biological law of accommodation, right? You are a biological organism, and as exercise is a stressor, as you expose your body to that stressor, it's going to respond less and less to the same stressor. And it does that because it is responsive initially and your physiology is changing with the expectation that it needs to prepare itself for that next encounter with that stressor, right? And I use a gross example. I mean, it's just very generic, not gross, but like if someone were to swing at you, okay, they might hit you the first time because you were unprepared. But the next time, you're going to move out of the way or you're going to put up your hands, okay? So that's a stressor and you're reactive to it. So your improvement in fitness in response to activity or an exercise stressor is just your body's way of being prepared for the next time, getting another shield or another arrow and just getting ready so it's prepared for its next encounter. Okay? So what happens is over time, you need to make a new cocktail, strengthen it by changing any of those ingredients, frequency, intensity, time, or type, and creating what we call overload. So this is a stressor that's greater than what you're accustomed to experiencing day to day, okay? So that means you have to increase the strength of your cocktail or modify it so it's something new for the body to encounter and react to. Another thing is recovery. Recovery really should be in that cocktail glass, all right? But I just couldn't find a big enough glass to fit it in there. But recovery is equally as important as exercise because exercise is a stressor, you need to give your body adequate time to rebuild, okay? If you continue to exercise with such frequency and intensity over time, that's constant stress on your body, and that can have health consequences. So it's important, right? It's not a no pain, no gain concept, right? It's important that recovery is inserted properly between your days of activities or any exercise bouts. The last thing I want you to consider is making activity, this cocktail, a part of your daily routine. Okay, like getting up and brushing your teeth, getting dressed, doing the dishes. Okay, consistency is the key. Although a lot of fitness adaptations occur in the first month or so, if you stop doing it, you will lose the adaptations. Just like if you take a medicine and it works and you stop taking it, the medicine is not effective. Okay, so for consistency, the best strategy is behavior modification or change, incorporating something new into your daily habit. And so Dr. Barry, what he's going to talk about now are strategies for incorporating activity into your daily habits so that you reach your physical utopia.
Excellent. Thank you, Dr. Grubbs. So either by a little nod to me or raise your hand if you're brave, raise your hand if you feel like you are on this path of doing your activity cocktail, or if you feel you are there. Okay, you can give me a little nod or a little raise of your hand if you feel that's the case. Let me just say congratulations to those of you that gave me the nod or raised your hand, that you are on the path, you're doing it. And let me say this. The fact that you came here today, signed up for the conference, and chose to come to this class, you have a desire to change. That is the first step. So you're actually starting already. So congratulations for everyone let's do this. We can start this together. So what I'd like you to do right now is to think about the last time you were consistently active. Okay? Or maybe it was a planned exercise bout, planned exercise routine. I want you to think about the characteristics that surrounded that time in your life. Okay? I'm going to give you about 20 seconds with me not saying anything, and I want you to think about the characteristics that surrounded that time in your life. Go. All right. So, what I'd like you to think about right now is age is not a limitation now. You can incorporate those characteristics into your life now. What are some ways, I want you to think about this, what are some ways you can incorporate those things that worked for you in the past? How can you incorporate into your life now? Okay? Did you have a coach, a personal trainer, something like that that was helping you along the way? Great. Whatever it was, go. You can implement them now. There's no age limit on those things. Okay? So these guidelines, this fit cocktail that Dr. Grubbs was talking about, yes, it is sometimes difficult to achieve. Life is hard. Sometimes things get in the way, and it's hard to fit that in with our busy schedule. What I'd like you to do, what I'd like to talk about right now is what are some of the barriers that are stopping you from incorporating those principles back into your life. We just thought about some things that of a time when you were active. What are things that are stopping you from doing that? And I've got 4 items here on the board that are common behavioral barriers that stop us from being active. Okay? And I know I've fallen into all of these at least several times in my life. Okay? And so there are many more barriers out there, but I wanted to talk about a few and some solutions to some of these barriers. So first off, I don't have enough time. I know for me, I have a busy schedule at my work a lot, and what I've done at times is I'll park 10 minutes away from my office door. I know 5 days a week, I'm going to get 20 minutes of walking every day. I know that. I don't have to engineer anything into that. I'm almost there already, only because of where I parked once a day. Okay? And so that's one behavioral strategy that worked for me to help me on my way to match that cocktail. Okay? So another thing we can do here, we adjust some of our priorities. We think about, okay, I have my utopia that I want to get to. Is this part of my priority to get there? And can I put that into my life? What are things that I can remove that are in my way of getting to that utopian concept that I want to be a part of? Okay? If anything comes to mind, please write that down. This is what I can remove. This is how I can change my life. Okay? The not having enough energy. I've got a 15-year-old daughter that's always, Dad, I don't want to do anything. I'm too tired, whatever. But if there's a cute boy involved, she is there, right? And for her, that is her reward system. Oh, there's going to be cute boys there. Oh, I'm going to go to the gym. I'm going to do whatever. She doesn't have a gym membership for that purpose. But that is her reward system, and she'll go anywhere for that. What is it that helps you be more active? Is there a reward system that you can put in place for you that even when you don't have enough energy, I will get up and do that for this. For this, I will be able to do that. Okay? Another thing that also helps is new activities. St. Clair Senior Center has great activities. If you haven't been there, go check it out. They might be able to get some new activities for you that, hey, I might be able to step out of my comfort zone. And even if I don't have low energy, I can get there. If you're not motivated, one thing my wife likes to do, and this fits in the other reinforcements categories, is she loves scenery, whether it's beautiful buildings or nature. So we could go walk down Main Street all day long for her, and she'll just sit there and stare at all the beautiful buildings, and she just loves it. We can go walk through nature and up to a beautiful waterfall, and that's her thing. But if we have to walk through our neighborhood, I don't want to do that. That's not fun. There's nothing to look at. So for her, it's where is she going to be? And so if I can engineer beautiful places for her to exercise, she is all about it. Okay? So engineer places to go, things to do that you enjoy and that you love, and that will help with that motivation. And finally, the last thing I want to talk about is just if you're sick or hurt. There are two main things I'd like to state here. We can adjust the exercise intensity. You can still be active even though you might have a hurt knee or a hurt ankle. One way is adjusting the intensity, and so instead of walking quickly like you normally do, maybe you just do a nice leisurely stroll this week. You know, this week I need to just slow things down, let my body heal a little bit, and slow it down. Another option is changing the type of activity. Maybe you're a walker. Maybe instead you sit down, use a TheraBand, and do some sitting exercises, just until your body recovers and is back and is able to go at it again. But please continue to be active. So finally, the last thing I'm going to talk about before I turn it over to Dr. Bloodworth is it's great to set goals. I've been talking about this whole presentation, and Dr. Grubbs has, about our physical utopia. And we've been trying to get you to think, what does that mean for you? Okay? The more specific we can be about what is our physical utopia, the more likely we're going to be able to obtain that. Okay? So if you decide it, you can be, that's you being self-determined. And then you write down that specific idea. This is what it means for me, for my health, and for doing things I want to do. That will help us get to that point. Okay. When you're deciding on these goals, it's always nice to do short-term goals. This is the thing I want you guys to write down right now before we finish. Before I turn the time over to Dr. Bloodworth. What can you do today or this week that will help you get started to start you on that path to meeting your physical utopia? What can you do today or this week to help you get started? As you write that down and ponder on that, we want this to be measurable, something you can say, yes, I did it. It's action-oriented. You did it. It's realistic, something that you can actually attain, and it's timely. You're going to do it by the end of today, or you're going to do it by the end of this week. Okay? That's what I want you guys to ponder on and write down. All right, I'm going to turn the remainder of the time over to Dr. Bloodworth.
Thank you. Well, I am motivated to get up and move, so I get to stand up and move, and I'm sorry you're going to have to sit for just a few more minutes, but we'll finish up here real quickly. I want to talk about things that help us do the things that we've talked about and things that present themselves as challenges. And so when summer comes around every year, I'm reminded of spending the summers on my bicycle. Did anybody grow up riding your bike all summer? Do you remember the days when you left in the mornings and you were allowed back in the house for meals and you had to be back by dark? But other than that, we didn't go inside. And that's how I spent my summers. But another thing that I remember is spending much of the summer with no skin on my knees because I would have a bike rack. I'd rush home, put a Band-Aid on, run right back out, spend the rest of the day on my bike, And when I woke up the next day, guess what I did? I popped out of bed, I got back on my bike, and I rode again the whole day. So I could do that when I was younger. Now, if I had a fall on a bike at 61, I would either be in the hospital or I would definitely feel it when I tried to get out of bed the next day. So as we age, it just gets a little bit harder, right? We have more challenges to doing those things that we love. In fact, a few weeks ago, does anybody play pickleball? No pickleball? Oh, good. It's a great game. So a few weeks ago, I played pickleball, and for some reason I thought I could do the things I did when I was young. So I dove for a ball, and let's just say at 61, again, I have some arthritis. I had a hip replacement a year ago. I couldn't do the things I thought I could do, and I ended up, long story short, with a knee injection and off my feet for a few days. But it's just a little bit harder. So I think the model or the picture of this scale, a balance scale, is a good way to think about things that help us be active and engaged in the things we love versus the things that challenge us. And this is my not so artistic rendering of a balance scale, but I think it'll work for us. So when we were younger, we had a lot of things on that positive side of the scale. Right? We were strong. How many of you, when you were a child, had to exercise to keep your muscles strong, keep your endurance up? We didn't do that. We just lived because it all came easily. Things could happen, but it wasn't very likely. And if we had an injury or an illness, we were back up on our feet pretty quickly because our scale was heavily weighted toward the positive. Now, as we age, as we get a little bit older, so as a young adult, maybe we start taking on more stress. Maybe we have some vision changes. Our balance isn't quite as good as it used to be, but there's still a lot of things on the positive side of the scale, right? We still have muscles that are strong. Our balance is pretty good. Endurance tends to stay good. Vision, hearing may be pretty good as a young adult. But then as our life experience continues to increase, we find a few more things shifting over to that side of the scale that has our challenges to being active and to doing the things that we love. Our muscles aren't quite as strong. Vision and hearing may be a little bit off. Our balance isn't quite as efficient. We're not as fast at regaining our balance as we used to be. Maybe we have trouble sleeping as we age, and so we don't have the energy the next day that we used to. I remember as a child hearing people say, "Did you sleep well last night?" And I remember thinking, what an odd question. Who would not sleep well? You go to bed, you sleep great. I never thought you might not sleep well, but as I've aged, I understand that question a little bit better, right? So that's added to the challenge side of the scale. Our endurance isn't quite as good, but there are some new things that are also added to the positive side of the scale. Sometimes as we age, we may have more time available to exercise and be active, to do some of the things that we love to do. Especially as we near into retirement. We've got more time to invest in this. There are community resources available for seniors that might not be available for people in other life stages. We have healthcare providers who are trained and focused on helping seniors stay active and stay well. And the good news is that some of those things that were on the challenge side of our scale, we can actually move over to the positive side of the scale. We can work on those things. We can work on getting our muscles stronger, improving our endurance if we do the right kinds of exercise. We can get our balance better. We can improve our balance if we do the right kinds of exercise. Dr. Grubbs mentioned walking speed. It's fascinating, isn't it? How fast we walk indicates how healthy we are and maybe even how long that we might live. Well, there are a lot of reasons why our walking gets slower generally as we age. Most of those we can do something about. Sometimes it's as easy as just stretching our ankles, because if our ankles aren't flexible enough, it's hard for us to get power as we're walking, to get our walking speed up. Some of those things are pretty easy to do. So we can shift those things from the positive or the challenge side of the scale to the positive side of the scale. So we're not as vulnerable, not as likely to not continue the things we love to do. So the question is, what can I do to shift things from the challenge side of the scale over to the positive side of the scale? And again, the good news is there are a lot of things that are under our control that we can do to kind of take things off the challenge, put put them on the positive side of our scale. And there's several of them that you see listed here. We're not going to talk about each one of them, but the point is we can take control of many of these things. I am a physical therapist, so I am biased when I tell you physical therapists can help you with this. Physical therapists who are trained in geriatrics, we have another geriatric specialized therapist in the back, Mia. We not only work with people after injury or illness, and most people think of PTs in that context, we can actually help seniors figure out what's on the positive and what's on the challenge side of your scale and figure out how to shift everything possible, how to load up the positive side of each person's scale to hopefully prevent illness and injuries to the best of our ability. So I highly encourage you, find a physical therapist. I'm happy to help you with that. We can help you look at that and figure out how to optimize the positive side of your scale. So when you came in, you got a couple of handouts, and this is one of them. This is an exercise that you can do at home. It doesn't count in your 150 minutes of exercise for the week, unfortunately, but it is an important exercise to do. The other sheet that I gave you as a handout lists these things, and there may be many more things that you can add to it. So what I'd like for you to do is take this home and think about what's on the positive side of your scale, what's on the challenges side of your scale, and then start to consider what are the things on the challenge side of your scale that you could possibly move over to the positive side, or what can you load up on the positive side to minimize the impact of the things that you can't move off of the challenge side. So again, a physical therapist can help you with that. Other healthcare providers can help you with that process. But you've got these tools to take home and think about some of those things. Turn it back over to my colleagues here.
Just one last slide I'd like to share with you before we take some questions. Just some community resources here in Murfreesboro that I'd like you to be aware of. Most of you may already know of them, which is great. These top three are through the city, and the top two are just minimal charge. And this Silver Sneakers is an online resource, and it's pretty cool. They'll have some online activities that you can do and online videos that you can exercise at home if you'd like for free. They have a little survey for you to do to see if you qualify to work with their stuff. And they can also connect you to community resources in the area. So I'd recommend going and check out that if you haven't already. So thank you guys for your time, and we appreciate you coming. To answer any questions that you might have for the three of us.
Any questions?
It's coming.
It is coming through?
There it is.
Okay. My comments are, I really appreciated the cocktail that you were talking about and how you could build it, make it stronger, but just the movement. And you know, I've always thought, oh, I just don't have the time, I don't have the time. But how you presented that you could do 10 minutes here, 10 minutes there, you know, I think that we get in our mind and we get that concept that we have to do those bouts in the 30 minutes in that 1 hour, and we've got to have that intensity and not just getting up and having that purposeful movement. So I really appreciate it.
Thank you.